Hello, everyone. We've got Dr. Ryan on the line. Good morning, Dr. Ryan. Thanks for joining us.
Thanks, Mark, for having me.
All right. Well, I know you just went through the numbers, but if you could just review it for our listeners, where are we at, particularly here in Clear Creek County?
So here in Clear Creek County, we have, as I stated on the call, we have 18 active cases. That means 18 folks who are actively COVID positive with symptoms in isolation. Our vaccination rate has ticked up ever so slightly. Part of that is due to the federal government now including in our state data folks, for instance, who go down to the VA and get vaccinated there. Prior to a couple weeks ago, they were not included in our numbers, but they are now. So we're at about 60.9%, almost 61%, who are fully immunized in our county, and about 5% more who've received one dose to date.
Well, that's encouraging. I guess we're making some progress. I wanted to ask you, I want to spend some time talking about the kids going back to school, but before we do that, I wonder about this lag time that was so thoroughly discussed with your Board of Health update. My question is, I guess, a little bit different. I just wonder, because there's vaccines, as you said, being distributed at the VA, but also all the other venues that are offering vaccination. I just wonder how long it takes the state to compile that data and how fresh it is just on any given day.
Yeah, that's a good question, Mark. So the federal data, as I call it, meaning anything that's given at a federal institution, whether it's a jail or a prison or the VA system, or if there was any, for instance, nursing care facilities that were run by the federal government. That data is separate and wasn't actually a part of nor integrated in the state data. It's only the recent request from the states that the federal government has subsequently handed that data over to the state governments. But if, for instance, you went to Larimer County today and got vaccinated, we would have that data would go into the state system within 24 to 48 hours. So we would have here in Clear Creek County, if your home of record was Clear Creek County, we would have access to that and know that fact that you got vaccinated in Larimer County only days later. It's part of the state regulations about vaccines and how quickly you need to enter the data into the system so that accurate and up-to-date information is kept. So two really separate things in terms of data. And getting the federal data has been very good from a number of perspectives. The statewide has been very helpful because we now can have a better sense of what is the true rate of vaccinations in the state without having to guess on the sort of the federal end of it.
Well, that sounds like a pretty robust system. I'm encouraged by that prompt reporting of data so that when I look at the numbers, I can be assured that those are pretty accurate in the way they're described. I wanted to ask you also about this hospitalization rate. I heard you say that we currently have 25 residents who are hospitalized from Clear Creek County, and also that our 2-week cumulative total of cases is 18. So it sounds like this hospitalization rate is fairly high, and I guess I have two questions. The first being, where does that 25 number stand in regard to maybe what our peak was last year in the fall and early winter? And also, can you describe what a typical stay in the ICU for a COVID patient might look like? I know there's a great range, but there's there are some commonalities as well. Could you describe those?
Sure. The first thing I'd say is the hospitalizations that I mentioned on the call wasn't our rate. It was the sum total so far. And those numbers I give on a weekly basis. The number of fatalities, as an example, is 3, and hospitalizations 25. That is to date. That's how I have traditionally, since the beginning of this, presented those to the commissioners. If we had an additional hospitalization or two this week, for instance, that number would obviously jump to 26 or 27. Those are not currently active hospitalized individuals, just as a point of clarification.
Okay, that's my bad. I apologize.
No,
I misunderstood that.
That's okay. There's a lot of numbers in the sheet that I have. The other thing I said, we currently have 18 active cases. What that means is individuals who are currently on isolation. So you tested positive. You tested on Tuesday. Today you found out you're positive. You are included in that. So it's anybody in a 10-day window who is actively positive. Right. So that's very different than looking at our 2-week cumulative incident rate or our 1-week cumulative incident rate. These are people who are actively infected. Also, we could potentially get, for instance, if somebody calls and says, I'm symptomatic, I haven't been tested yet, but I know I have COVID for these reasons. I live with someone who's COVID positive. I have symptoms, etc. We would put those individuals in the active column, if you will, suggesting that they haven't gotten a test yet, but if we had to guess, we're probably 99.9% confident they are, in fact, COVID positive. So it may include, but the vast majority of those individuals who are active have had a COVID positive test. It's on occasion we have to add other individuals for reasons I just explained.
Okay, well, thank you for that. And then could you, as my follow-up question, I just kind of threw it in there, but I am interested to hear your description of what a stay in the ICU for a COVID patient might look like. Again, acknowledging that there is a broad range of circumstances and outcomes, but there are some commonalities to an ICU visit, and maybe you have some sense of what that looks like for someone who might go in the ICU with COVID.
So if an individual goes into the hospital and it's determined by the clinicians on the scene that individual would need to be admitted to the intensive care unit, which is what ICU stands for, the likelihood is that individual is in probably pretty bad shape. They don't, at this point particularly, put people in the ICU who don't need to be there. Right? If they think they can manage you as a clinician and patient in a normal clinical room, they would put you there first, given the limited number of ICU beds that we actually have in this state. They can't just magically make more ICU rooms. There are specific things in ICU rooms that make it an intensive care room. So the individual who goes in that room is in probably pretty bad shape. As it relates to COVID, they're probably having a very difficult time breathing and are going to need to be potentially intubated. What does that mean? They literally stick a tube down your throat. It's probably the most uncomfortable thing as a human you will encounter from a clinical perspective. As you might imagine, it can't not possibly be comfortable. How quickly an individual gets out of that ICU or whether they do or at all, meaning they very well may die there, depends highly on the level of sickness that they have. Also, a number of different factors: how old they are, their age, any underlying health conditions they may have. A number of different variables will play into that from a clinical perspective. So it could range anywhere from a week to months. Individual might be in there. And they can't move a patient out of the ICU until it's clinically determined that they could survive in a normal hospital room and or at home and get home care. So that's really a clinical decision, but it could range anywhere from a week all the way to months on end. And it's really up to the individual and the clinical team that's managing that person how long they're going to be there. Unfortunately, as you know, the probability of you coming out of the ICU, meaning you end up dying in the ICU, at this point is fairly high. The case counts are going through the roof. Hospitalizations are following quickly behind, and fatalities are quickly on the rise as well. It's just the reality of when you go into an ICU for any reason, whether it's COVID or heart transplants or other things, it's intensive care, and it requires 24 hours, 7 days a week care. This really gets at some of the fatigue of those teams. Those teams have been working their fingers to the bone and putting their own health and safety at risk for 18 months now. And the vast majority of folks that they're seeing now, 99.9% of the folks in the ICU for COVID are there because they're unvaccinated. And so a lot of them are struggling with that reality, that they're continuing to risk their lives, but others are not willing to make any sort of decision for self-preservation before they even get there. And so it's causing a lot more fatigue that is already significantly underlying these individuals, given their work over the last 18 months and continues to do so. So it's really stretching the workforce. Nurses are quitting, and for reasons I just stated, they've been working for 18 straight months tirelessly, and they don't really see an end in sight. They don't see any concern in the general public that, from at least half the population, that this is an issue and of concern, and yet they're supposed to continue to go to work and put their lives at risk because that's the reality they live in.
Well, that was very helpful to me. I hope that our listeners came away with some sense of the urgency to not let that happen to you or your loved ones. Dr. Ryan, we've spoken for many times over the course of the last 15 months about the dangers of contracting COVID and the ways that we can stay safe and the science surrounding the pandemic. And I've been saying this for the last few weeks, and I just don't think that there is a certain portion of the population that's ever going to be convinced. Somehow the vaccinations they received over the course of their life, where they didn't think twice about it, those were okay, but somehow this one is an impingement on their freedom. I just don't care about that, their attitude or concerns anymore. I just care about us getting out of this thing, and I think that there's going to have to be some stricter enforcement measures to go in place. I just don't think education and encouragement is doing the job.
Yeah, I think, Mark, to your point, the corporate world is recognizing quite quickly if they want economic stability and they want social stability, et cetera, addressing this is everyone's job. It isn't just public health's job. It's the entire country's job. And the corporate world, as you've seen over the last week or so, is starting to step up to the plate to say, if you're going to work here, you need to be vaccinated. If you're going to work here, you need to be vaccinated, et cetera. A lot of people suggest that somehow the emergency use authorization is the reason they're not getting it, and they're waiting until it's fully authorized. Here's a fact. Historically, in all of humanity and vaccine development, any sort of symptom, side effect, long-term effect is apparent within 60 days. This is fundamentally why the FDA and other agencies require 60 days of data to, at a minimum, get emergency use authorization, because they know that if anything's going to arise, it's going to arise in that 60-day period. That's why they ask for that 60 days of data. They've more than gotten 60 days worth of data. They've gotten, in many cases, 6 months of data now that they've already analyzed, scrutinized. So that switch from emergency use authorization to full authorization is nothing but an administrative stamp, if you will. It doesn't fundamentally change anything as far as the vaccine is concerned, as far as distribution is concerned, as far as the safety or efficacy of it. Absolutely nothing changes. It's literally a stamp of approval and the federal government's stamp on that. It's an administrative thing that should have no impact on your decision making. Over 350 million people in this country have already received the vaccine. Many months ago, I received mine, 8 months ago now. And as indicated by their reaction to the Johnson & Johnson vaccine, if 6 cases of a side effect or symptom are present and they shut down the entire distribution of the vaccine, it says to me how seriously they take any indication of a problem with that vaccine. And so somehow that this stamp is going to change your mind. If it does, that's great. And I really hope the FDA moves quicker than they are and that approval is given soon. But if that's your reason or rationale, just understand it is nothing but, at this point, an administrative position, and the efficacy, safety of the vaccine isn't going to change because the federal government puts a stamp on it.
Yeah, I just think that's one of the key facts that I see concern around that very issue. And, if there's one thing that's going to convince some portion of the people out there, perhaps that's what it is. Just take a look. 350 million doses given, and in that time, how many hundreds of thousands of people have died of COVID, and how many hundreds of thousands have been hospitalized in those extreme circumstances that you described, compared to the minimal side effects that some people have experienced when they receive their vaccination. It's a no-brainer to me. I don't understand it, and I'm through trying to be sympathetic to those sorts of concerns. Get the shot. All right, let's move on. I'm sorry, but I wanted to give you a chance to speak about the new facility. I know you're moving you and your staff's offices to the new healthcare facility. Can you tell us a little bit about that?
Absolutely. We're planning to move soon. It was delayed, and strangely enough, by the mudslide west of us had an impact on our fiber optics and our ability to get internet to the building. So it delayed us by a little bit, but we're hoping to move into that facility next week, the Collaborative Care Center on Colorado Boulevard in Idaho Street. Not Colorado Boulevard.
It's Minor Street, 1969 Minor Street. I was in college.
Exactly, Mark. Minor Street. And so we are hoping to move in there next week and continue our operations there. The concept behind the building and the facility is really around having a sort of one-stop shop for a whole host of services that not only the county provides, but also private entities. So Centura is downstairs, and we'll have a have a primary care office space there. They have a physician, several nurses, and we'll be conducting primary care and most clinical stuff there. In addition, they're planning to have a physical therapy practice there, also on the first floor, so that folks don't have to go all the way to Evergreen or down the hill as we traditionally have across the county. And then upstairs, we're going to have public health will be up there. We'll have 2 exam rooms up there, so our public health nurses can do all of the programmatic offerings from a clinical perspective upstairs. And then human services will be there as well, and a whole host of different county services. The advocates will be there. Jefferson County Mental Health will have several offices there, and we'll be able to provide on-site counseling and things of that nature. So really trying to have as many services as possible present at that facility so that an individual can come there and actually take care of many different things at once without having to go anywhere else, without having to walk anywhere else in the town or in the county. So it's a great facility. It's, I believe, one of the largest buildings in Idaho Springs, although you might want to fact-check that. It's certainly the newest. And it will provide an opportunity for the broader community to really, have a place to go and really address all of their needs that they may have from a clinical or public health or human services perspective.
I just want to say I drove by today, and it's actually thrilling to look at that beautiful facility and to think of the services that are going to be offered in, as you say, one-stop shopping in that facility. It's such an incredible positive addition to our community. I'm so happy that you're finally going to be moving in there, and I wish you nothing but the best in your new facility. So congratulations, and congratulations to all of us for having such a beautiful facility in our community. I wanted to move on to a subject that I know is on many people's minds throughout Clear Creek County, and that's the opening of the schools and the impact on the Delta variant, on the decisions that have been made to keep students and staff safe until we can finally get control of this current wave of cases. Can you tell us what the details might be?
Absolutely. So, as you know, I've been working with the school district from day one. Absolutely wonderful partners in collaboration and really trying to do what's best for the students. As you know, their primary goal is to educate kids as best as they possibly can in the safest possible way. And keeping those two things in mind, putting measures in place that help protect the children first and foremost and provide them the opportunity to learn and to be in school every single day that we can. I think what worked for us last year worked quite well. We had very few interruptions. We had very few quarantines necessary because, in my opinion, of the measures that were put in place. More importantly, the reinforcement and collaboration and cooperation, not only from the school district but also from the student body and teachers, play a very important role. Right? You can have rules, and if nobody follows them and no one enforces them, then they're not very good rules. So hats off to the entire school district, teacher, staff, but also the students. So this year, because we don't have vaccines available yet for those kids under 12, they are 100% vulnerable. There's nothing to protect them from the current variant of the current virus. And so in order to keep them safe, and given the middle school, high school vaccine rate isn't quite where we want it to be, we have decided collectively to mandate masks for everybody, teachers, staff, and students alike, while they're inside. So they will be masked up from the moment they arrive until the moment they leave, with the exception of when they go outside. And I know the school is working hard to encourage and offer opportunities for classes to go outside so that kids aren't wearing masks for 7-8 hours a day. They have many opportunities throughout the day to go outside, take their mask off, and enjoy the outdoor air. In addition to that, the hand washing stations that were there last year are going to continue to be there and continue to encourage students to wash hands. Those are the two most effective ways of curtailing the spread of the virus other than the vaccine. Mask wearing and hand washing, those we've known for hundreds of years from a sanitation perspective in terms of how to prevent and slow the transmission of disease. In addition, all of the staff who are unvaccinated, which right now is less than 25%, those individuals will need to get tested twice a week to make sure and confirm that they are not, in fact, COVID positive. The last thing we need and want is any student or staff walking into the school actively positive. The more that we can prevent that from happening, the less interruption overall for everybody will have. And so those staff, the teachers, are going to need to get tested twice a week in order to maintain that. And we are going to continue to have isolations. Obviously, that's a reality that isn't going to change. If you're COVID positive, you need to be in isolation for 10 days. If you are a close contact, for instance, and there's lots of different scenarios that I'm not really going to talk about right now, but if you're an unvaccinated individual and you have a close contact, you're going to need to quarantine. That's just the reality. For vaccinated folks, it's a little bit different, and it depends on the specifics of the case in terms of exposure, et cetera, et cetera. But there are instances where they will, in fact, need to quarantine as well. But those are very few and far between.
So those are determinations, I suppose, will be made by your nursing staff on a case-by-case basis. I was wondering about this testing regime for the staff, the unvaccinated staff, and I wonder, is that going to be provided by the county nursing staff, or is there some other mechanism for ensuring that everyone is abiding by that testing protocol?
Yeah, so we're going to have a number of options. As we discussed earlier, the more options we have for folks, the more feasible it is for this to actually happen. So it's going to be a combination of things. Last year, we partnered with COVID Check Colorado and had testing in the school system as well as the jail. That occurred every single week. That was administered by, in those two instances, the nursing staff of the jail and the nursing staff at the school in partnership with public health. So we're in the process right now of working the details out. But, for instance, if you live in Lakewood and you're a teacher at a school in Clear Creek, and it's convenient for you to stop by the Jefferson County Fairgrounds, which is on your way to and from work, and they have testing far more readily available than we do in Clear Creek County. If you get tested there and then show that proof of testing and results, more importantly, to the school district, that will be satisfactory, right? It doesn't necessitate you get tested by us. It necessitates that you get tested and show that you are, in fact, negative. So we're still trying to work out the details, and obviously it's going to depend on, frequency. It's going to depend on where folks live. If it is more convenient to go near your house on your way home or on your way to work, by all means, to do that. But we're going to accommodate those folks. And we hope that the number of folks we need to test drops, right? Because if you get vaccinated, you don't need to get tested anymore on the same regimen. So we're hoping that our number gets down to a far more manageable number in terms of how many people we need to get tested every week or how many need to get tested.
Okay, and that will be monitored by the school administration, is that right?
Correct.
All right. Well, and let's talk about students and testing. I heard you say that there will be a quarantine protocol in place for those that have had an exposure. I suppose you'll discover those through contact tracing. Is there some testing protocol that will be in place for the students as well?
Yeah, so students have had the opportunity to get tested all of last year. For instance, the testing that was done at the school was open and available to both students and staff. We did have a handful of students on any given week who chose to get tested. Obviously, we can't mandate that because they're not employees; they're students, and they're also underage. So that's a parental thing that needs approval. If students want to and have their parents' approval, they literally can get tested every week in the same fashion that we're going to be testing some of the staff. So that is an option. It has been an option in the last year and will continue to be so.
That's great to hear. Now, the last question I wanted to ask you was regarding those students who are eligible for vaccination. I heard you say that the rate of vaccination in that cohort is a little disappointing. Do you have some plans to try to convince them or educate them and to vaccinate them?
Yeah, we've done a number of things. So first and foremost, this year we offered, because we now have 3 nurses, we're able to do this, offer sports physicals. And in that process, offered them the vaccine at that point in time. So one direct route to the student body. The second thing is we're going to continue to do what we've been doing in terms of promoting it. And a lot of this, unfortunately, isn't up to the students. It's up to the parents, particularly the kids in 7th and 8th, 9th, 10th, and 11th grade. It's only until you're 18 that you have the right to choose whether you want a vaccine or not. So the folks who are under 17, it's really convincing their parents of the importance of getting their kids vaccinated. And if you look at the vaccine rate, to your point earlier, the vast majority of students are vaccinated for everything else, measles, mumps, rubella, et cetera, et cetera. So the reason and rationale behind not getting the COVID vaccine is what we're trying to address. It's not that these individuals are against vaccines. They historically have vaccinated their children over the many, many years. So it's about convincing them. We're going to offer in-school vaccine clinics at the beginning of school to identify individuals whose parents say, yes, you can get vaccinated, and or their parents want to get vaccinated at that point. So continuing to make it as convenient as humanly possible to get a vaccine here 8 months into this. And all our other efforts that we have on social media and all the other platforms, trying to get the word out and the facts out. And, you know, who knows if the full certification of the vaccine, once it's given by the FDA, if that changes course of some people, if that is, in fact, their trigger to get vaccinated or not. We'll see. The proof will be in the pudding at that point. But
okay. I guess one last question. I know that you must have made contingency plans if things go south and case rates start going up, and particularly amongst the student body. Are there thresholds that you have considered for closing the schools or instituting stricter policies?
At this point, we don't have a fixed number. It's really going to depend on a number of factors, right? The first is how many cases do we have? How quickly can we contain those cases? It's also going to depend on the vaccine rate at that point in time. You know, if we're talking about 2-3 months from now and our vaccine rate jumps up to where the teachers are, that will be far less impactful. And this is the whole point of this entire exercise, where we're trying to get. That if we have enough people vaccinated, the potential risk for significant spread and significant disease is far less, and subsequently less impactful, obviously, on the education and learning. So we don't have any hard and fixed numbers. It's really going to depend at that very moment, if it's 2 months from now, what all these sorts of numbers look like and what we have going on, right? Did everyone in the school go to a super spreader event? And yes, we only have 5 cases now identified, but we can anticipate in the next week half the school becoming COVID positive. Our actions will be very different than if we have an isolated incident where a family goes on vacation and is exposed and gets COVID, and we can isolate them quickly. Those are 2 very different scenarios that would have very different outcomes for the school. So it's sort of a figure it out as we go, and using the best methods that we have and ones that have served us well for many, many years.
Well, I know that looking back at the way it was handled last year, I know the school district has taken this very, very seriously, and they have been as thorough as possible in their response, and have remained nimble as your department has in responding to crises as they arise. So I'm confident that we're going to be our children are going to be safe and looked after with the greatest of care. So thank you to you and your staff and all of the administrative staff and teaching personnel in the schools. I just am very, very pleased at the way it was handled in the past, and I don't expect any less this year.
Yeah, you're welcome. And we were one of the few school districts in the state that were as open last year as we were. We missed 2 weeks that were intentionally placed to help buffer the travel that was occurring during Thanksgiving and Christmas. So there's no need to fix what isn't broken. As you said, it worked last year, and we're relying on facts and science and not all the rest of the stuff that's out there. So it has served us well, and will continue to do so.
Okay, Dr. Ryan, that's the extent of my curiosity this week. I want to give you an opportunity for the last word. Do you have anything you'd like to share as we wrap it up today?
Mark, just the reality is this. 99% of those going to the hospital and dying of COVID at this point, which is a preventable disease, are the unvaccinated. The vaccine is safe and efficacious. 350 million plus Americans have received it, and it's 8 months in, with no long-term side effects, as has been reported on news agencies and Facebook and other places of misinformation. So, the science is there, the facts are there, and so I would encourage everyone to get vaccinated as quickly as you can, and get your children vaccinated when they are eligible if they're under 12. It will go a very long way to correct course in this country, because right now we are headed in the very wrong direction. We all would love this pandemic to be over, but the reality is it isn't. And we have half the country who's still unvaccinated, even though we have a vaccine and it is a completely preventable disease. Yet we're losing hundreds and hundreds of Americans on a daily basis from what is a completely preventable disease, and we have the answer to it. It's just a matter of taking that answer.
All right, Dr. Ryan, thank you once again for all the great information that you've shared with us. I know that if anyone has any questions regarding vaccination or testing, or even, I suppose, anything to do with the response in the schools, I'm sure you would be glad to field any of those questions. Let me see if I can find that phone number real quick, or maybe you have it on the top of your head, the number for the Clear Creek County. Let me see.
Yep, I do.
Oh, good.
303-670-7528. That's 303-670-7528.
And, of course, clearcreekcounty.us, all that great information is logged on that page as well. So thank you once again, Dr. Ryan, and we'll talk to you soon. Let's keep our fingers crossed that people will decide to get their vaccination, and let's get on with our lives as best as we can and get out of this mess as soon as possible. Thank you so much.
Thanks, Mark. Thanks.
Okay, goodbye.